The following segment is sponsored by Providence Health and Services.
Telehealth, seeing your doctor over video chat, is now standard practice thanks to the pandemic. But what about physical therapy? PT often requires hands-on treatment, so how do you do that virtually? As part of their Family Matters public service campaign, Providence Health and Services shows us how most virtual PT appointments can work for the patient. Here's KATU's Steve Dunn.
Hi, Julie. It's so good to see you.
Good to see you, too.
This is the beginning of a virtual physical therapy appointment. The patient, Fiona Karbowitz, is getting treatments from Providence rehab therapist Julie Larson.
How is your neck and shoulder feeling today?
Well, things are okay. It's been a pretty good week.
Fiona hurt her shoulder in a car crash last spring, early in the pandemic. Her treatment includes these meetings, plus exercise videos Fiona does on her own time. The work in between appointments is key.
It reinforces sort of the things you show me during our visits, and then I can then be able to connect to that during the week when I'm not with you.
Fiona learns new techniques over video chat. During this appointment, she learned some new stretches with elastic bands to ease her shoulder pain.
A little bit wider than arm width apart. There you go.
Fiona works from home now, like a lot of us, which can mean she doesn't stand up or move for hours, which doesn't help when recovering from an injury like hers.
Once you're sitting and not moving for hours at a time like this, boy, it just really does all sorts of negative things to the body.
Before the pandemic, she would commute daily by bike. She misses having exercise fit so perfectly into her workday.
That difference now is having to be very intentional about fitting that in and making it part of the day and the routine.
What Fiona is learning during PT can actually help anyone who's working from home and sitting a lot. One example, putting a simple air bladder on your chair.
You can sit on it and it makes you wiggle through the day, so it's engaging your core and your trunk.
While she misses those in-person appointments, this new approach, for the most part, is working for Fiona.
That physical element of a visit obviously can't occur, but the exercises and the strengthening have all been just as good as before.
Larson has seen similar results with her other telehealth patients.
Strongly encourage people with even just a little pain, come on in, make an appointment, do a telehealth visit, and see what's going on, and then we can take care of it quickly.
That was Steve Dunn reporting, and we will be bringing these Family Matters stories throughout the year. It's all part of a Providence Health and Services public service campaign dedicated to educating and motivating families. You can find out more on our website at katu.com/Family Matters.